previous questions, if there are any left, which I feel there were a lot of questions left to be answered. I hope you can write down and I can answer those questions. Now let us just discuss a case where there was a very interesting case. The patient basically, had a lot of fear whether he will be able to, clear the exams, or whether he will have a good placement in the college. He was appearing for the engineering exam, and he said that whenever he faces fear, he sometimes has constipation, sometimes diarrhea, sometimes gases in the abdomen, and a lot of anxiety and stress. So we gave some medicine. There was a little change, but not getting good relief. One thing the patient came and told me that was very interesting. The patient says that whenever I have fear, the patient told that whenever he had fear, there was a lot of bloating of the face. And the mother used to understand that the child is suffering, has a fear, because she could see the bloating in the face. So we did his thyroid test, which was T3, T4, TSH, and the anti-TPO, that was normal. With this symptom, I just prescribed the patient a single dose of Carbovax 200, and after that, there was a wonderful change in the patient's personality. Of course, the bloating was much better, the physicality of the patients were much better. In fact, he cleared the exam with very good results, and now he is in the second year, and he is very happy with his performance, his admission, and his state of health. So Carbovax is a very important symptom, that whenever there is fear, the face is bloated. I hope you understand this, Dr. Nitin, Dr. Khatri, Walaikum Assalam. So Carbovax 200. Namaste everyone. Let us go forward. So now there are few things which you have to understand in relation to fear. I'll just take a question first. घर से निकलने में, बाजार में जाने में डर लगता है. So the patient, this is a question where the patient says that whenever he goes out in the streets or in the shopping area, he has a lot of vertigo problem. This is a very simple thing, and this is a very common problem of vertigo. You have to think about 2-3 remedies which are very important, which I have used in my practice with very good results. The first is aconite, of course. The second is opium, and the third remedy, which is again a very infrequently used medicines, I have also used that very infrequently. The remedy is theridion. Okay. Drowsiness together with depression, Dr. Nitin or whoever it is, please understand that what is the cause of depression, and then we'll be able to answer this question very easily. I think every time your question is related to depression and anxiety, I've always told you one thing: try to find out the cause. A person is not born with anxiety or born with depression or born with drowsiness. Everybody passes through a stage of depression, anxiety, fear, mortification. How does he react to that situation, and what is the cause of these complaints are very important in case taking. Welcome, Dr. Bharat. Good afternoon. Dr. Babel, hello. So I was discussing something in relation to face. Now, bloated face because of fear, we have understood Carbovax. Now there are 3-4 remedies we have to understand when there is bloating of the face. There was one thing, there was a very interesting symptom in the patient. Now remember, this symptom of Carbovax, again a very interesting symptom of Carbovax. Whenever a Carbovax patient is talking, especially in a group company, he has bloating of face. See, a very peculiar, very unique symptom of Carbovax. Whenever the patient is talking in company, in a group, there is bloating of face. So these two symptoms of Carbovax, do remember in your practice, because you will get a lot of cases where sometimes you fail, and this symptom, the symptom which you can see in your OPD, when the associate of the patient can see in the patient, becomes a very important striking feature. Just one symptom of bloating before I shift to the question. Whenever there is bloating of face during fever, please remember this: whenever there is bloating of face during fever, please think about Cilicia. Please think about Cilicia. And whenever there is bloating of face with headache, remember this remedy, Solanum nigrum. Solanum nigrum and Cactus grandifolia. I have used this in migraine patients. Whenever there is bloating of face during headache, do think about this remedy. Hello, I hope everybody is understanding what I want to tell you. These are very, very unique symptoms of the remedy where you cannot get in the sometimes Mathematica or in the books you read. But these are very, very unique symptoms that you can see in your patients. Then the associate of the patient living with them can see and tell you and guide you to the remedy. Otherwise, we can't think of cactus, we can't think of carbohydrates, we can't think of this remedy in bloating. Okay, make sure that you first of all do the test of thyroid or whatever the primary disease you think for bloating, and then you can proceed to the remedy. I hope everybody understanding. Hello everyone. Let us go over. Yeah, good afternoon, Dr. Navjot. Sir, mild hepatomegaly, liver size 140 millimillimeter. Hepatomegaly. See, if I want to tell you some remedies for liver, I can tell you a lot of remedies for liver. But still, I would have be very happy if you basically tell me what are the symptoms because of that. See, whenever you are talking about liver, this congestion in the liver, there is inflammation in the liver size, liver is enlarged. There are 3-4 remedies which are very, very important. You can write down because of the questions you have asked. First is lycopodium, second is magnesium mure, third is natrum sulph, fourth is nux vomica. Of course, we have caradusmar, we have chelidonium, we have lauracerasis also. But if you tell me, exact complaints why the patient is suffering from liver complaint. For example, enlarged liver because of taking a lot of alcohol, alcoholic enlargement of liver. You can think about nux vomica, lactases, sulfuric acid, or enlargement of liver with fever. Then you can think of ferrum ars, enlargement of liver because of anger or after anger. You can think of, I think, cocculus is there. So there are a lot of other symptoms if you can add and get to the remedy. That is important. Good afternoon, Dr. Tisha. Navjot, yeah. We should be the daily routine for health life. Give some advice. Dr. Dheeraj, daily routine, what I tell you? Have a good breakfast, go for work, after work or any time in the day, at least have 45 minutes walking or light exercise, sleep early, don't eat after 7 o'clock. That is the advice I can give you in general. Sir, one baby 2 years of old crying for at 12 or 1 a.m. in the night, holding ankle area of leg since last 3 days, sometime holds cheek. Please suggest medicine. Oh, so it's a very interesting case, the baby holding the cheek and leg. There are few remedies where you have to think about two things. The baby cries all day, sleeps all night, or baby cries all night, sleeps all day. There are few remedies which are very, very important. These symptoms: lycopodium, jalapa, sorinum, senna. In your case, do think about one more remedy, and that is maccarb. Okay. Stool softener. See, there are a lot of remedies. See, I don't prescribe on specifics at this part of my practice. Okay, give remedies like opium or selenium or thuja or nux vomica. I don't prescribe this type of practice. I should have some symptom to prescribe, baby. Yeah, so I hope you understood something about the baby. That's important for me. Real matter 37. Yes. Hello, are you with me? Understanding that? Thank you so much, sir. A baby having excessive dryness of skin is much better now. Okay, that was the case dermatitis. The case you sent to me. I think one of the case you have sent to me, one more, which I think I would answer today because I was out for 3 days. So I'll answer that to you also. Okay. So which remedy we gave, Navjot, in that case? Okay, it was sudden screaming in the night. See, whenever the baby is there, sudden screaming in the night, there has to be some cause. I have found in my practice, the colicky pain in babies are very, very important. Because of that, there is a lot of pain and that's why the baby keeps shouting. So please rule out that colicky pain. Think about belladonna, think about colchicum, think about colocin, think about aconite napellus, think about sulfur, think about magnesium. These are the remedies you think about, but make sure that the baby is not suffering from colicky pain. inflammation in the stomach, because of digestion problem, because of vomiting, because of acclimatization, because of weaning. These are the symptoms where the baby starts shouting and crying at the night. Of course, there are some babies who cry because they are suffering from ear pain also, and sometimes urinary tract infection. So try to find out the cause rather than just give for sudden symptoms. Sudden crying, if there are no cause, you can think about aconite napellus and phosphorus. Yes, sir. So thank you. I will give her medicine which when he came to me after a week. Okay. So I hope Dr. Khan, you understood something about the baby screaming at night. Suddenness, you have these symptoms, but try to find out the cause. That is very, very important. Now, just to give you something in relation to liver problem, just make sure by examining the liver, enlargement of liver is one thing. Sometimes the liver becomes very hard, and when there is hardness of liver, you have to add 2 or 3 remedies which are very, very important. Whenever the patient is hardness of liver, do think about iodine, phosphorus, and arsenic. These are very, very important. And you can also add sulfur iode. I had a very interesting case of hardness of liver, digestion problem, lot of GERD problem, stools not proper. The patient was very upset because of bloating, gas and all. I tried 2 or 3 medicine, it failed, but then on examination, the liver was very hard. Adding 1 or 2 symptoms, I prescribed the patient sulfur iode 30, and the patient responded very well to the treatment. So just make sure that whenever you are doing something, you have to have a cause why there is a problem in the patient and why you are prescribing the medicine. That is important. In years of time, when you are writing why you are prescribing, you develop your own mater medica, the clinical mater medica, which you can refer every time when you are a practitioner more than 25-30 years, so that you have the clinical experience of prescribing. Hello, I hope everyone is understanding. If not, then you can tell me something, I will improve, or if yes, just give me something thumbs up so that I know that you're understanding. Otherwise, I feel that I'm talking to the computer sometimes. Let us go forward. Yes, so something in relation to face, I told you about bloating. Now see, there is something which is called as non-verbal communication, which I always teach to my doctors who are attending me in my practice. Now there are some remedies where you can see the face and understand that it could be this remedy. For example, whenever you see the face of the patient and you find the veins are distended, you can see the veins on the face, distended veins on the face, and the patient say, "Doctor, sir, please touch here." You can find the vein is pulsating, and you can see on the face that the vein is pulsating. I had a very interesting case. Of course, that case was not responding to the common indicated medicine. The case taking was done, but nothing was working. So I tried to prescribe on this remedy, this patient where the veins were distended, pulsating on touch also, and I could see also visibly the vein was pulsating. I prescribed the patient peppermint, that is kava, and the patient responded beautifully to the treatment. That was a case of migraine. I thought because of the congestion of the face, because of the migraine, because of increased blood supply, it was a problem. But no, just by symptom prescription, and the patient came out with the peppermint 30. This is the importance of non-verbal communication. You can write down certain remedies where the veins are distended. You can see in opium I have prescribed with good results. Glonine I have seen, China and ferrum metallicum. These are the remedies which I have seen frequently in my practice. There are other remedies also where you can think of prescribing, but these are the very commonly indicated medicine which I have seen in my practice. Hello, are you with me? Yes, anyone? I hope you're understanding. There are so many persons use online, but only few doctors respond. So I hope you're understanding what I want to tell you. Now, there are some cases where the patient enters in your chamber and he says, "I am 20 years of age," and you say, "At 20 years, how is the face appearing so wrinkled and not responding to that age, not visibly seen that he is 20 years, appears maybe he's 25, 30 or 35 also." Okay, so whenever you see wrinkled face, it could be at any age, but if you find that the wrinkling is more than expected at this age, ruling out the primary cause of this. If you see deep wrinkles on face, deep means the wrinkles are there, they are very deep inside. Do think about two remedies. In fact, one remedy I have used so frequently in my practice. I have told to my assistant doctors also, I think if they are looking at this YouTube live, they'll appreciate this remedy. I had a case where the patient was suffering from viral infection on the penile area. It was viral infection because of unprotected sex, and it was herpes infection, and the patient had taken treatment with no results. Deep wrinkling on the face, and I prescribed the patient single dose of Lycopodium 200. For 2 years, the patient had follow-up. I had never repeated Lycopodium, and the patient is much, much better. Of course, then you must ask the question, if there are deep wrinkles, if you think of Lycopodium, and if they're very fine wrinkles, then think about calcarea carp and arsenic. I hope you are with me, everyone. Hello, everyone. Good afternoon, Dr. Vishaka. Sir, baby always attached with her father in want quite this habit. I would say the father is lucky and the child is lucky that she has a father, and the father is lucky that she has the princess. So I think attachment, if it is out of control, then you can think of the remedy. I had a case where the girl was so attached to the father, so much attached, that even the father used to go to the bathroom, the baby used to stand near the bathroom and wait for the father. So that was too much clinging. We prescribed the remedy and the patient is better now. Otherwise, attachment is okay. So you can't give medicine to get detached. That's what I feel. Okay. Hi, Dr. Sharma Disha. Yeah, medicines for muscle. Again, Nitin, there are no medicines for muscle weakness. Otherwise, every case of cerebral palsy or spinal muscular atrophy we could have cured. No, there has to be a reason for muscle weakness. So in case taking, I am not a prescriber who prescribe only on specific. Tell me the case. Tell me some symptoms in which I can tell you some medicines. I am not a prescriber by disease, that muscle weakness drug X with this drug Y. It's not like that for me. Okay, sorry, I can't answer the question. Yes, so in wrinkles, I'll just add to that. Wrinkled face, you can also think about remedies like sanicula, sepia, fluoric acid, and soranum, I think I told you, and phosphorus. And of course, then you can differentiate that it is deep or fine, more in the forehead and on the lips, whether the lines are horizontal or vertical. So there are a lot of things you can think about. But basic, generally, wrinkled face is a very, very interesting symptom you can see on the patient's face. And then these are non-verbal communications. So let us go forward. Attached इतना है कि father को चुपचाप बाहर. Yeah, so this is, I don't know whether to prescribe on this symptom. This is a very common symptom. Sometimes the child does not get the love, the affection which she expects from a father, and the father is hardly at home because of the work pressure, like us doctors or all professionals. So the baby is missing the father. So I would suggest that counseling is important, and the father should be advised to give a quality time to the patient. Unless the baby is getting sick every time because the father is not there, recurrent cough and cold, nuptial enuresis, constipation, or anything which is because of she's missing a father, then we can think of prescribing other medicines rather than this. That's my suggestion. Family history of hypercholesteremia, no specific symptom. What's LDL to be reduced? This is my favorite topic. I had this for MD, for PG, and for PhD also, hypercholesteremia. Normally, family history of hypercholesteremia, the answer lies there, Dr. Disha. This is a psychotic history. And if there is a psychotic history, and understand what are the psychotic symptoms in the patient personality, add to that, and the family history is also very important. Psychotic history is important. So you can think of antipsychotic medicine to start with, or we can say to open up the case, and then you can take the re-case taking and prescribe the medicines. You can think about Thuja, you can think about natrum sulph, you can think about medorinum, you can think about these three remedies, or you can think that the patient is suffering from a silent grief where the patient is not coming out coming out because of some suppression, and because of that she's suffering from a problem where the lineage is there, and that's why the psychotic miasm is working in that patient. So this is, in this case, intercurrent to open up the case, and the psychotic history and the grief history, you would get the remedy. Male 35 years, sir, I have had drum size 1 in the parotid gland, I want to rest it, can it? Yeah, Dr. Manish, I had a case of parotid gland tumor. If I am not mistaken, that case is on the YouTube also. We had cured that case, so we can definitely treat that case person. Diabetes, yeah, diabetes in muscles. Make sure that the diabetes level is normal. And for muscle weakness, you can think about Matfos, you can think about lecithin, you can think about alfalfa, you can think about Evanesceteva, you can think about creatine, you can think about Rustox, you can think about Simasifuga, you can think about Calcarea, floor, lot of remedies. Pain in edge of foot, whole side. Yeah, this is again a very interesting case, because it's sometimes difficult, because the patient is a person who is standing or walking job, so that's why the pain is there. Think about ruta, calcarea floor, ledum pal, symphytum, calcarea sulf, hypericum, rustox. I think I've already answered that question, Nitin. I hope you can go again see my YouTube, because I'm very fast sometimes. Whatever remedy comes, I'm very fast. So you can go, if you have missed some remedies, you can definitely go and again check it. I hope Dr. Manish, you have understood that answer. It's easily, and you can cure that. I have treated some cases. And as always, I would only answer those questions which I have seen, treated, and have got results in my practice. I also discuss cases where I have not got results. For example, somebody was asking me something specific for something which I have not, for stool softener type. So I don't use those medicines like Senna or Carlsbad or Thuja or Silicia. So I will not be able to answer the question. Hindi. Yeah, so Hemant, I am in English because there are some doctors who are out of India, especially the European crowd. That's why I'm in English, because they don't understand Hindi. So if you feel some difficulty, you can again, see my YouTube and understand what I want to tell. That's the problem, because they absolutely don't understand Hindi. That's why. Suggest medicines for subchronic hematoma. Subchronic hematoma in uterus, Dr. Khan. Faisal, I have not seen cases in my practice so much so that I will be able to answer that question. I have a lot of cases of fibroid, endometriosis in my practice which I have treated and cured. But whatever understanding I have in treating these type of cases, it is very important to have the whole case taking done and then get the remedy. Or in case of uterine complaints, if there are very something defining features in relation to uterine complaints. For example, if the patient says whenever there is pain, whenever he suffers from uterine complaints, he has watering from the eyes, he has pain in the chest, he has pain in the thighs, then you can take this type of defining symptoms of the local pathology and prescribe. That also becomes the personality of the patient. Okay, let us go forward. सर किसी से ट्रीटमेंट लेते जैसे मैंने होमोपैथिक प्रूविंग, आई हैव आंसर्ड दिस क्वेश्चन बिफोर ऑल्सो. Wherever the patient has come to you and has been treated by any doctor, homeopathy, allopathy, people always ask me, sir, you antidote with this medicine, what is the antidote and all. I always tell them, the simillimum you prescribe is the antidote and the curative medicine for the patient. That is what I believe. The simillimum you prescribe is the antidote and the curative medicines for that patient. I hope I am very much clear. Yeah, Doctor, I hope, I don't know the name, Mr. Yeah. So let us go forward. कुछ समझा नहीं आएगा इंग्लिश में तो. Dr. Hemant, it's not like that. I am very slow. I'll be more slow. But you can always go to my again YouTube live and see it. I think you will understand that. So let us go forward. This is first trimester condition, subchronic hematoma, severe bleeding, risk for miscarriage. Yeah, so I'll answer that question to Hemant. हम लोग Instagram live हिंदी में लेना शुरू करने वाले हैं. तो आप उसमें ज्वाइन करिए, मैं आपको उसका लिंक भेज दूंगा। सो मैं उसमें हिंदी बोलने वाला हूँ। Dr. Khan, first trimester. See, very interesting. Yeah, Dr. Khan. So now the body is trying to show you, what she wants. Severe bleeding risk for miscarriage. Make sure how is the bleeding, character of bleeding, and how is the symptoms in the uterus, whether the patient has fear, whether the patient has anxiety, whether the patient has apprehension. Because of that, what are the changes the patient is going through in the mind and in the body, and that is your prescribing symptom, doctor. This is a very, very good question, and do prescribe on this, because you'll be saving the life of the patient, the fetus which is inside, and the emotional attachment of the whole family, because she's pregnant. That's important. So the change state because of the symptom of the uterus, that is important. Gallbladder stone, again I would say sometimes very difficult to treat, but there are few remedies. If you want, I can tell you. That is, first is Carotis marinus, Belladonna, Colocynth, Berberis, Filtauri. These are the medicines that come to my mind. Of course, I always go through the similar with the constitutional approach. Sir, HbA1c is 10.8. क्या ये homeopathy से control? Yeah, why not? HbA1c, I have had cases where it was 14, and now the patient is better. It has come down to 8.7 today only. In diabetes, I would suggest that if the patient is taking allopathy medicine, don't stop immediately. Give some time to your medicines, and then automatically you can start tapering the medicines. Fasting pepper 3.1. C peptide is okay. You can take chance and give the medicine. Don't stop immediately. Otherwise, if the patient is not on any other medicine, prescribe the patient homeopathy medicine. Tell the patient to check the sugar every third day, fasting post meal. And this is how I basically come to know whether if the sugar is coming down, that your medicine is working. If not, then you have to refer to a doctor, because it may go up and it may damage some organs, the kidney, the heart and all, and then or the eyes, and then you can land up in a problem. Tell the patient to take it simultaneously, and then you can start tapering of the medicines. This is what I do in my practice, and this is what I basically teach to all doctors. They will tell you how do I practice also. Okay. Thank you for the quick written reply. It's so helpful. Thank you. Yeah, Dr. Babel, that is when I came from Germany, this was the query. So that's why I made sure that whenever I speak, I know that I speak fast. So I have told my assistant to write the remedies, and Rizwana also. Sir, Siblimum के बाद Syncona medicines one importance की proving to nahi. If you feel that the patient is proving the weight, don't give placebo. Okay. Hereditary spastic paralysis. So what do you want to treat the patient? The case taking in this case is very, very important. Very, very important. Okay, that is very, very important. And why did the patient landed up in this spasticity? The family history, of course, is important, and the history of the patient when in the fetus, and how is the patient behaving now. How to cure melasma case? Very good question. For me also, it is very, very difficult sometimes, because you don't get any symptom apart from melasma. I have cases where I have got results, but I have cases also I have got no results. Some remedies which I have used very effectively in my practice: China Ars, arsenic, sickle core, sulfur, sepia, pulsatilla, calcarecar. Cataract, sir, any remedy? Yeah, we have remedy. In cataract, we have remedies. The most important remedy in cataract in homeopathy is Cinerea maritima succus. Cinerea maritima succus. We have eye drops also for Cinerea, but in potency I have seen very good results in Cinerea. Insta पर बात कर लूँगा पर पेट के. Okay, fine, Dr. Hemant, I will make sure that we can stop on Insta. No problem. I hope you understand that, because of the it's a very pan-India crowd, so everybody is there. Phosphorus and diabetes. See, if you want to have no symptoms of phosphoric acid, you can go to any mathematic and you can get the answer. There are remedies like symptom like weakness is there and everything. So you can go and check in the mathematics. It's very easy. And the mind symptom of phosphoric acid is very, very important. Allen's keynote, go and take the first, read the first symptom of Allen's keynote. Treatment for alopecia areata, of course, I would say case taking, because it's a constitutional problem, and with case taking you would have good results. I have good patients of alopecia areata, alopecia universalis, where there was no hair, and with the medicine we tried, we had good results with that. Thank you so much, and thank you for joining, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you so much. Goodbye until next Saturday.